Welcome to the Legacy Education ICD-10-CM Guideline Review Series. I am Tiffany Roach, the coding coach, and I will be walking through the ICD-10-CM guidelines with you. This video will cover the chapter-specific guidelines for Chapter 15, Pregnancy, Childbirth, and the Puerperium, represented by codes 000 through 09A. This presentation is designed to review the ICD-10-CM guidelines that are effective for both fiscal year 2024 and 2025. There were no changes to the guidelines from fiscal year 2024 to 2025. When coding for obstetric cases, Chapter 15 codes 000 through 09A are required to be reported. These codes in Chapter 15 will take sequencing priority over codes from any other chapter when codes from other chapters are needed to further specify the conditions. If the provider states that the pregnancy is incidental to the encounter, meaning that the patient is pregnant but the pregnancy is not the reason for the encounter, code Z33.1 should be used instead of the Chapter 15 code. This code should only be reported when the provider specifically states that the condition being treated is not affecting the pregnancy. Another important note for Chapter 15 codes is that they should only be used on the maternal record and should never be assigned to your newborn record. Lots of codes in Chapter 15 will require a final character to indicate the trimester of pregnancy. If you aren't familiar with the time frames for trimesters, they are as follows. The first trimester is anything less than 14 completed weeks. The second trimester is 14 weeks and 0 days to 27 completed weeks. And the third trimester is 28 weeks until delivery. These timeframes are also included in the beginning of your Chapter 15 codes that are found in the tabular list. There are some codes that do not have a final character to indicate your trimester. This could be because either the condition always occurs in a specific trimester or because the concept of trimesters is not applicable within that condition. Also, there are some codes that have final characters for certain trimesters because the condition may not occur in every trimester, but it can occur in more than one. For instance, you may have a condition that is only present in the second and third trimesters. Assignment of your final character for trimesters should be based on the provider's documentation of trimester or weeks for the current admission or the encounter. When a patient has been admitted and a delivery occurs during the current admission, you should look for the option that states in childbirth. If that option does not exist, then it would be appropriate to assign a code to describe the current trimester. If the patient is admitted to the hospital for complications and moves into the next trimester during the admission, the trimester for the complication code should be assigned for when the complication developed. If the condition developed prior to the admission or the encounter or is a pre-existing condition, the character for the trimester at the time of the admission or the encounter should be assigned. The unspecified trimester codes should be very rarely used, and only when the documentation is insufficient to determine the trimester and it is not possible to obtain any clarifications. When appropriate, a seventh character is available to identify the fetus that the complication is affecting. Be careful when assigning your seventh character 0, as it can be used for a few instances, such as if the pregnancy is for a single gestation, meaning there's only a single baby, when the documentation is unable to determine the fetus that is affected and it is not possible to obtain clarification, and when it is not possible to clinically determine which fetus is being affected. In ICD-10-CM, the phrase completed weeks of gestation will refer to full weeks. If the provider documents 39 weeks and 6 days, the code for 39 weeks of gestation should be assigned as the patient has not reached 40 completed weeks. When a pregnant woman visits the doctor for routine outpatient prenatal visits and no complications are present, a code from category Z34 should be assigned to represent the encounter for the supervision of normal pregnancy. If complications are present, you should report a Chapter 15 code for the complications instead of Z34. Codes from category 009 are intended for use only during the prenatal period to indicate a supervision of high-risk pregnancy. When complications occur during labor or delivery as a result of a high-risk pregnancy, you should assign the applicable complication codes from Chapter 15. If there are no complications during labor or delivery, code 080 should be assigned for encounter for full-term uncomplicated delivery. If the encounter is for routine outpatient visits for a patient with high-risk pregnancies, a code from category 009 should be assigned, followed by codes from Chapter 15 to represent any complications that are present. When an encounter occurs and there is no delivery, the principal complication of the pregnancy that prompted the encounter should be listed as the primary diagnosis. If more than one complication is present and treated during the encounter, any of the complications can be sequenced first. When an OB patient is admitted and delivery occurs during that admission, the condition that prompted the admission should be coded as your principal diagnosis. If multiple conditions are responsible for the admission, you should sequence the one that is most related to the delivery as your principal diagnosis. If any other complications occur at the delivery, those should also be assigned as your additional diagnoses. When a C-section occurs and it was the result of the condition that prompted the admission, the condition should then be your principal diagnosis. If the condition that prompted the admission is unrelated to the condition that resulted in the C-section, the condition related to the reason for the admission should be your principal diagnosis. Anytime a delivery occurs, a code from category Z37 should be recorded on the maternal record. These codes should never be used on any subsequent records or a newborn record. Some conditions in Chapter 15 will distinguish between conditions that existed prior to the pregnancy and those that are a direct result of the pregnancy. When you're assigning a code from Chapter 15, it is important to determine if it was pre-existing or if it developed during the pregnancy. When the category does not distinguish, it can be used for either. Category 010 should be used for hypertensive heart and hypertensive chronic kidney disease that are pre-existing and present in pregnancy. When assigning a code from 010, it is necessary to also code the appropriate type of heart failure or the type of chronic kidney disease. Categories 035 and 036 should be assigned only when the fetal condition is responsible for modifying the care of the mother. For example, requiring any diagnostic testing, additional observations, or even termination of the pregnancy. The fact that the condition exists does not justify assigning a code from these categories. When surgery is performed on the fetus while still in utero, a code from category 035 should be assigned to identify the fetal condition that is being treated. Under no circumstances should a code from Chapter 16 be assigned to your maternal record. If a patient is admitted because of an HIV-related illness during pregnancy, childbirth, or the puerperium, a code from subcategory 098.7 should be assigned as your principal diagnosis, followed by a code for the HIV-related illness or illnesses. If the patient is asymptomatic, a code from 098.7 should be assigned, followed by Z21. When diabetes is present in pregnancy, a code from 024 should be assigned, followed by the appropriate code from categories E08 through E13 in order to identify the type and complication present. When long-term use of insulin or oral hypoglycemics are used, you should follow the guidelines that are outlined in Chapter 4. Gestational diabetes or pregnancy-induced diabetes can occur in the second and third trimesters in patients who were not diabetic prior to pregnancy. When this occurs, it can cause complications in the pregnancy that are similar to those of pre-existing diabetes. And it can also put the patient at higher risk of developing diabetes after the pregnancy. When gestational diabetes is present, a code from subcategory 024.4 should be assigned. It is important to note that there are no other codes from category O24 that should be assigned together with O24.4. Codes from O24.4 will include whether the gestational diabetes is diet controlled, insulin controlled, or controlled by oral hypoglycemic medications. Therefore, Z codes to specify the usage of insulin or oral hypoglycemics are not to be used in conjunction with O24.4. When an abnormal glucose intolerance in pregnancy is found, then a code from subcategory O99.81 should be coded. When sepsis or septic shock is present in pregnancy, childbirth, and the puerperium, in addition to a Chapter 15 code, a code for the specific infection should be assigned. If severe sepsis is present, a code from subcategory R65.2 should also be assigned, as well as any codes for any associated organ dysfunction. Code O85 for puerperal sepsis should be assigned with a secondary code in order to identify its causal organism. If severe sepsis is present, a code from subcategory R65.2 should also be assigned, as well as any associated acute organ dysfunction. Codes from categories A40 and A41 should not be used to identify puerperal sepsis. When a pregnant patient uses alcohol during the pregnancy or during the postpartum period, a code from subcategory O99.31 should be used. And then a secondary code from category F10 should also be assigned to identify any manifestations of the alcohol use. When a pregnant patient smokes or uses tobacco during pregnancy, childbirth, or the puerperium, a code from subcategory O99.33 should be assigned. And then a secondary code from category F17 should be assigned to identify the type of nicotine dependence. And then lastly, when drug use is present during pregnancy, childbirth, or the puerperium, a code from subcategory O99.32 should be assigned. Then a secondary code from subcategories F11 through 16 or F18 and 19 should also be assigned to identify any manifestations of the drug use. Now, it is important to know that this can include either illegal drug use or inappropriate usage or abuse of prescription drugs. When coding for poisoning, toxic effects, and adverse effects, as well as underdosing in a pregnant patient, a code from subcategory O9A.2 should be assigned, followed by the appropriate injury, poisoning, toxic effect, adverse effect, or underdosing code. And lastly, a code should be assigned to indicate the condition that is caused by the poisoning, toxic effect, adverse effect, or underdosing. When a full-term delivery occurs of a single healthy infant and there are no complications through the entire pregnancy or childbirth, code O80 should be assigned. Code O80 should always be assigned as a principal diagnosis, and it should not be used in conjunction with any other Chapter 15 codes. Codes from other chapters may be used with O80 if it is specified that they are not related to or it does not complicate the pregnancy. If there was an antepartum condition that has resolved and it is not present at the time of delivery, it is still appropriate to code O80 for the uncomplicated delivery. And then when O80 is reported, code Z37.0 should be the only acceptable outcome of delivery code. The postpartum period begins immediately after birth and for 6 weeks following birth. The term peripartum is defined as the last month of pregnancy to 5 months postpartum. When any complication occurs within the 6-week period after delivery, these are known as postpartum complications. It is appropriate to use Chapter 15 codes to describe pregnancy-related complications after the peripartum or postpartum period if the provider documents that the condition is pregnancy-related. When a mother delivers a baby outside of the hospital prior to admission and she is admitted for routine postpartum care, code Z39.0 should be assigned as long as no complications are noted. Pregnancy-associated cardiomyopathy can be diagnosed in the 3rd trimester and possibly can continue to progress for months after the delivery. It may also be referred to as peripartum cardiomyopathy. Code 090.3 should be assigned only when the cardiomyopathy develops as a result of the pregnancy, and it should not be used when there is a pre-existing heart disease. Code 094 is to be used in cases when an initial complication of pregnancy develops a sequela or a late effect requiring care or treatment at a future date. It can be used anytime after the initial postpartum period, and as with all sequela codes, 094 should be sequenced following the code that describes the sequela of the complication. When an attempted termination of pregnancy results in the live born of a fetus, code Z33.2 should be assigned, as well as a code from category Z37 to indicate the outcome of delivery. Subsequent encounters for retained products of conception following a spontaneous abortion or elective termination of pregnancy that do not have any complications are to be coded with 003.4 or 007.4. These codes are appropriate even when the patient was discharged previously and is readmitted. If the patient has a specific complication that is associated with the spontaneous abortion or the elective termination of a pregnancy, in addition to the retained products of conception, the appropriate complication code should be assigned, such as a code from category 003, 004, and 007, instead of 003.4 or 007.4. When complications of the pregnancy are documented, codes from Chapter 15 can be assigned following codes in 004, 007, and 008. When hemorrhage occurs after an elective abortion, code 004.6 should be assigned, not 072.1. When abuse is suspected or confirmed during pregnancy, a code or codes from subcategories 09A.3, 09A.4, or 09A.5, followed by the appropriate codes to identify any associated injuries because of the abuse. When COVID-19 is the reason for admission or encounter during pregnancy, childbirth, or the puerperium, a code from subcategory 098.5 should be sequenced first, followed by code U07.1, and then any appropriate codes for any manifestations. If the reason for the encounter or admission is unrelated to COVID-19 and the patient tests positive for COVID-19 during the admission or the encounter, and the reason for the encounter or admission should be listed first, followed by 098.5 and U07.1, as well as any manifestations. As always, thank you for supporting us, and stay tuned for new videos in our ICD-10-CM guideline review. Please make sure to subscribe to our channel so that you can be in the know of our newest videos as they are released.